I am Rosof. I'm chair of the Roundtable of Health Literacy of the National Academy of Science, Engineering, and Medicine. And I really would like to welcome everybody to this cool July morning here in Washington, D.C. to today's workshop on community-based health literacy interventions. Just a point of information, we are being videotaped and on webcast, so please, if you have a question or to ask a question, please identify yourself clearly so that we have that information for future reference. This is a very timely topic that we will be discussing today, timely for many reasons, but it is the focus of the social determinants of health that we've been talking about, so important in population health and improving the health of the community. So the topic today, community-based health literacy interventions, is not only timely, but important as we begin once again to try to achieve that triple aim. The Roundtable on Health Literacy focuses on building partnerships to move forward the field of health literacy. As one of its major activities, the Roundtable sponsors workshops for members and the public to discuss issues of importance and issues of concern. This workshop is centered around community-based health literacy interventions related to the current landscape, related to development and implementation, evaluation, and of course looking to the future, which we think is once again an important aspect of our discussion today. By the way, I will ask each Roundtable member, as I do each time, as we do throughout the day, keep in mind key ideas, key concepts that are brought out in the presentation and the discussion. And once before the conclusion of the meeting, I'll go around and ask each Roundtable member to briefly describe them and these very key highlights. The workshop was organized by a planning committee, and we would like to extend our thanks to the members of that committee. Steve Deutsch. Steve is here, yes. Yes. Laurie Francis, Romana Hasnain Winia, Andrew Pleasant, and Ernestine Willis. We'll begin today with a presentation of a commissioned paper by Cynthia Bauer. Cynthia, nice to have you here. The Roundtable commissioned Dr. Bauer and her team to write a paper that would build on prior work on community-based health literacy interventions and offer an updated overview of the field. After the presentation, we'll hear about community-based health literacy interventions that are currently ongoing in a moderated panel format, and we'll discuss that panel format in a few moments. After lunch, we're already at lunch, we have a segment devoted to the issues and challenges of evaluating community-based health literacy interventions, and finally, we will hear from a panel discussing the future of health literacy in the community. So it is a full day, and we hope to be able to have a very interactive discussion about the issues that we raise throughout the day. We will have time for discussion with Roundtable members, presenters, and panelists, and we'll definitely try to save some time, and we set aside some time for questions and comments from our audience. We find that that is a very productive part of our meeting. So we have a very full day, and we'll try to keep the introductions brief. And if you'd like more information on the presenters, on the panelists, on those of the Roundtable and the moderators, there's a handout of speaker bio sketches at the registration table. Please feel free to take them. And now I have asked Roundtable staff member Melissa French, where is Melissa? She's over there. To track time, so she will be giving each speaker or moderator a 5-minute, 2-minute, and a time up warning. However, we have in front of us today our own personal warning. So it'll be right in front of you with a red, yellow, and green sign and exactly the minutes left on your speaking. So I'll briefly introduce Dr. Cynthia Bauer. Dr. Bauer was appointed the director of the Horowitz Center for Health Literacy at the University of Maryland School of Public Health in January 2017. Before moving to the University of Maryland, she spent 17 years in communication leadership roles at the Centers for Disease Control and Prevention and the Department of Health and Human Services. That's a nice time to spend in the federal government. While working in the federal government, she led several and multiple initiatives to define best practices and guidelines for health communication and health literacy.
Dr. Bauer will be presenting the commission paper that she and her team at the Horowitz Center prepared for this workshop. Dr. Bauer, it is our pleasure to have you here today, and we're anxious to hear what you have to say.